I'm doing my PowerPoint on prostate cancer for structure and functions. The overview for we'll be talking about the prostate, the cancer, the cells and tissues and organs, the signs and symptoms, the benign prostatic hyperplasia, and the treatments. For the prostate, it is a gland in the male reproductive system. It lies just below the bladder and in front of the rectum. It is normally the size of a chestnut, and the main function for it is to produce the fluid which protects and enriches the sperm. Prostate cancer is a disease in which malignant cancer cells form in the tissue of the prostate. Malignant tumor is a lump or a growth of tissue made up from the cancer cells. They invade a nearby tissue and organs, which can cause damage. It often gets bigger gradually after the age of about 50. By the age 70, about 8 out of 10 men have enlarged prostates. It is usually found in men. In the U.S., about 1 out of 5 men will be diagnosed with prostate cancer. For the cells and tissues and organs, prostate cancer is caused by damages in the DNA of a prostate cell. Certain changes in DNA can make normal prostate cells grow normally and form cancers. DNA is a chemical in our cells that make up our genes, the instructions for nearly everything in our cells to do. Genes control when our cells grow, divide into new cells, and die. Oncogenes are certain genes that help cells grow, divide into new cells, and die. Tumor suppressor genes are others that normally slow down cell division, repair mistakes in DNA, or cause cells to die at the right time. Cancer is caused by part of DNA mutations that turn on oncogenes or turn off tumor suppressor genes. Early onset cancer, there usually is no symptoms. Advanced prostate cancer can sometimes cause some symptoms like passing urines, slow or weak urinary stream, or the need to urinate more, blood in the urine, trouble getting an erection, erectile dysfunction, pain in the hips, back, chest, or other areas from cancer that can spread to the bones, weakness and numbness in the legs and feet, loss of bladder and bowel control, cancer pressing on a spinal cord. The benign prostatic hyperplasia. When a man ages, the prostate may get bigger and block the urethra or bladder. Sexual problems or trouble urinating. Even though it is not cancer, surgery may be needed. Symptoms from BPH or other problems in the prostate may be like symptoms of prostate cancer. Signs and symptoms. It is slow growing. There may be no symptoms at first, even for years. As the tumor grows, it presses on and irritates the urethra. It causes a partial blockage to the flow of urine. If cancer spreads to the other parts of the body, various other symptoms can be developed. Most common site for the cancer is to spread to one or more bones, especially the pelvis, lower spine, and hips. Affected bones can be painful and tender. The first symptom to develop are from secondary tumors in the bones. Treatments, it can be complicated, vary tremendously between different cases. Treatment options are surgery, radiotherapy, hormone treatment, and chemotherapy. More treatments, often a combination of 2 or more of these treatments are used. These treatments, depend on the cancer itself, its size and stage, whether it's spread, the grade of the cancer cells, the PSA levels, and the man with cancer. It depends on your age and general health, personal preference of treatment. You may think that you need to make a decision quickly, but it is important to give yourself time to absorb and process the information you have learned. Some other treatments are cryosurgery, vaccine treatment, and bone-directed treatment. Some other treatments, different types of treatments are available for patients with prostate cancer. Some are standard, they currently use treatment, and some are being tested in clinical trials. Treatment clinical trial is research study meant to help improve current treatments or obtain information on new treatments for patients with cancer. Patients may want to think about taking part of clinical trials. Some clinical trials are open only to patients who have not started treatment. A new study found that 15 years after treatment with surgery or radiation, most prostate cancer patients have sexual side effects, and many also have urinary and bowel problems.